Hi, I'm Adam DeVore, a fellow at Duke University, and I'm joined by Matt Sherwood, an interventional fellow, also at Duke. Hi, Matt. Thanks for walking us through your data here today.
Sure. Thank you very much, Adam, for bringing me on to the Duke Fellows blog. Let me talk to you a little bit about the study that we started about 6 months ago, and then I'm very happy to be presenting at ACC 15. So we actually are looking at a subgroup analysis of the Appraise-2 trial. Just as a little bit of background, the Appraise-2 trial was a trial of acute coronary syndrome patients where they added a low-dose novel oral anticoagulant, Apixaban, to dual antiplatelet therapy for the secondary prevention of vascular events. What we can see here is when we then subset the group of patients who had prior stroke and those without, we can see that those patients with prior stroke were higher risk patients. They were older, they were more likely to have hypertension, peripheral vascular disease, and impaired renal function. And, as you might expect, they also had other risk factors. What we then wanted to look at was, we know that prior stroke predisposes you to probably having a higher risk for vascular events, and any patient who has acute coronary syndrome also has a higher risk for vascular events than a patient that doesn't. So what we first looked at was the composite of CV, death, MI, and stroke in patients with prior stroke versus those without, and we saw what we expected, that patients with prior stroke had higher rates of these events. The next part was interesting. We actually looked at whether there was an interaction between the treatment arm, either Apixaban or placebo, and a history of prior stroke with the composite endpoint. And what we found was indeed there was an interaction between treatment arm, the use of Apixaban, and a history of prior stroke. Patients who received Apixaban with prior stroke had slightly higher rates of CV, death, MI, and stroke than patients who did not receive Apixaban and had prior stroke. When we then looked at the individual outcomes of the composite, specifically CV death alone, MI alone, and stroke alone, we found that the difference in these outcomes was mainly driven by a higher rate of myocardial infarction in patients with prior stroke on Apixaban. I think what we can conclude from this in terms of clinical implications is that patients who have acute coronary syndrome are high-risk patients. Patients who have prior stroke are also high-risk patients, and that risk is not mitigated well by a novel oral anticoagulant or by the addition of anticoagulation. The other interesting finding, though, is if you take the patients who did not have prior stroke and look at their interaction, it looks like, unlike the results of the main trial, there may actually be a beneficial signal to the addition of Apixaban in those patients. So an interesting subgroup analysis provides some food for thought, maybe a hypothesis generating, and I think it'll provide us maybe some ideas for further questions in this population.
Well, that's great. This certainly complements your other work on novel oral anticoagulants. So thank you for sharing. For other updates from ACC, please follow us on the Duke Fellows blog.